So what do we look at when you bring your child in for an exam? Of course, we're going to look at things such as teeth, eruption of teeth, bite, but we're also looking at airway and growth. So what does that look like? What does that mean at Orthodontic Design Company? One of the things that makes us unique is our 3D X-ray machine. So not only can we see where our teeth are exactly in the bone as they're erupting, but we can also do a screening on a patient's airway, which you can see in color represented here. We're also going to ask screening questions about airway. Some of those are pasted here, and we have further in-depth screening questions as well if we need to. So when should my kids see an orthodontist? The short answer is 7 years and up. Now why is that? It's related to facial growth. In the big picture, 90% of all facial growth is done by age 12. And by age 7, you're no longer growing wider or in the transverse direction. So therefore, around age 7 is when it's ideal to look at, do we need expansion or expanders in that dimension? So when a patient comes in, this is an example of a 3D X-ray. Now what you'll notice is we can see where the teeth are in exactly in the bone and erupting, but what you'll also notice is where it says minimal cross-sectional area, 34.2. That's telling us in this airway measurement here, what's the narrowest point. In that same 3D X-ray, we can slice it and look at, are the tonsils large in that airway? Or we can slice it and look at this direction and see the tonsils. We can also look at adenoids and the adenoid tissue, which you can see here. So we know from the Journal of Oral Surgery that a 7-year-old should have about 70 square millimeter cross-sectional area of their airway, and that will increase as they age and then get smaller as we're an adult. As far as the cross-sectional area in obstructive sleep apnea goes, we know that there's a high risk, a moderate risk, and a mild risk looking at that cross-sectional area. So we know as we expand the maxilla and the mandible, we can actually change that cross-sectional airway value to decrease the risk of sleep apnea in the future, which we'll talk about in a later video. So the two common questions we often get is, when should my kids see an orthodontist? We want to see them starting around age 7, even if they don't need treatment. And do I need to wait for my dentist to give a referral? No, you don't. Feel free to reach out to us by call, text, or scheduling right on our website.